All right, welcome everyone to the Consumer Cannabis Council's second of our Intro to Cannabis series. It is called Women's Health in Cannabis, and our presenter today is, again, the intrepid Katie Sullivan of Modern Compassionate Care. If you have any questions, please drop them into the chat, and we'll get as many as we can, get to as many as we can, for us to get out on time at 1 o'clock Central Time. So if you've got any questions, just have them ready and just drop them in the chat as you have them, and I'll write them down, and we'll get to them at around 12:40 when the presentation is ready to go. So without further ado, let me welcome Katie Sullivan.
Hello, everyone. Can you see me? Can you hear me okay?
You are seen and heard.
Hello, everybody. Thank you for joining us for our second installment of the Elevation webinars. We're doing women's health today, and I'm so excited to be talking about this. It's a really fascinating subject, and I'm going to launch into it, but basically we're going to cover kind of the relationship between our endocannabinoid system and the female reproductive system, and then talk about how women can use cannabis throughout the lifespan for general wellness or to treat conditions. So let's get into it. Like John said, any questions, please just drop them into the chat. And we're going to have, did you guys lose me? And we're going to have a question and answer at the end. So let me share my screen. I'm going to pull up my slides here. Women's health. It's a very fascinating subject, but I want to start talking right away about not just women's health, but the endocannabinoid system. So when we talk about cannabis, I'm going to kind of start all the conversations bringing you back to this system, the endocannabinoid system that we are actually trying to stimulate here. So here is a kind of an image that you can see. The endocannabinoid system is one of the largest cell signaling systems in our entire body. Basically, it's throughout our central nervous system, our bones, our immune system, and all throughout the female reproductive system. The main goal of the endocannabinoid system is homeostasis or balance. So when we use cannabis, or even if you don't use cannabis, this system is working throughout your body all the time to manage so many things, including your mood, your relaxation, your stress level, energy balance and metabolism, the regulation of the female reproductive system, and the immune system. We're going to talk about all of that today. So, it's all connected is basically the point. And what I want you guys to think of when you're using cannabis is this system. This is really what we're working with. This is the reason why we use this plant. So it is crucial for regulating all of the basic, most necessary processes of life. John, can you move to the next slide? Thank you. Okay, so it's really important to understand that the female reproductive system and the endocannabinoid system are intricately linked. So the endocannabinoid system is present in the female reproductive organs, including the uterus and the ovaries, and it plays a regulating role in reproductive functions. So the endocannabinoid system is involved in controlling the release of hormones that are necessary for ovulation and fertility. And they also play a role in the implantation of a fertilized egg and the maintenance of pregnancy. But dysregulation of the endocannabinoid system in reproductive tissues can lead to various reproductive disorders like infertility, endometriosis, or even preterm labor. So, as we know, the endocannabinoid system can be modulated by cannabinoids, the compounds found in the cannabis plant. So it makes cannabis a very compelling target to treat these conditions. There is some really interesting research that's come out showing that this complex relationship between the endocannabinoid system and the female reproductive system and estrogen might account for differences in cannabis pharmacology. So that's, sort of the absorption, the distribution, the metabolism, and the excretion of cannabis. So there's differences between the sexes, and we believe that the female reproductive system and estrogen is one of the reasons why. So, just touching on this again, if you guys were here with us last time, I just want to make sure everyone's on the same page here. We're going to be talking about some terms. So, the two cannabinoids that I want to focus on today are THC and so THC is what we know as, the compound that gets you high, but it is also a really powerful um, medical and medicinal compounds. So it's great for chronic pain, for endometriosis, for sleep. It helps with mood elevation. There's many different things that it does, but it's an excellent compound to work with and best worked with in combination with this other compound, CBD or cannabidiol. So cannabidiol is non-intoxicating compound within cannabis, but it has really strong anti-inflammatory properties. It's also great for relieving anxiety. What it does is it exerts this moderating effect on THC. So it can help when you use them together, you'll have some less side effects from the THC, but you can also get a longer duration of action. So using them together is an excellent idea. Everyone is going to have a different combination that works for them. We all have different endocannabinoid systems, different bodies. So the approach to cannabis medicine is always very individualized with patients. So when you go to the dispensary, you're going to see products that are marketed in a ratio. So 1-to-1, 2-to-1. This represents a ratio, usually, double check always, there's other cannabinoids, but it's almost always a ratio of CBD to THC. So a 1-to-1 means there's equal amounts of CBD and THC in that product. And that is a great way to use it because you're getting kind of the benefit of both of these compounds that actually, when used together, they work better. I also like to think about CBD as this, and we're going to talk a little bit about this today, as an endocannabinoid system support. Two of the things that CBD can do, sorry, I'm looking at the chat right here, is increase the amount of receptors that are available for cannabis to interact with in your body, and also increase the amount of endocannabinoids, or compounds just like what we have in the cannabis plant here, or very similar, that's produced by our own body. So as we get into this a little bit more, when I talk about supporting the endocannabinoid system or improving endocannabinoid tone, CBD is a great agent for doing this. And I want you all to consider that, moving forward. So again, this is just basic safety stuff. If you're new to cannabis, definitely start low on the dosing and go slow. If you've never tried cannabis before, using 2 milligrams of THC is a good idea to start that low and slowly increase. What you're aiming for is the lowest effective dose. But like I said, everyone's system is different. So everyone is going to have a different lowest effective dose. You want to choose an appropriate method of consumption. We'll talk about that in a second. Definitely always check for medication interactions. Cannabis is very safe, but it does have interactions. And the more medications you're on, the more chance for an interaction. So definitely consult with, your provider when you're using cannabis in conjunction with other medications. And definitely if you're trying to reduce or replace a medication with cannabis, don't stop it without provider supervision. Definitely, if you're on an antidepressant, cannabis is making you feel a little bit better. Don't just stop taking the antidepressant. That's something you want to wean off of and speak to your provider about. So just some general kind of safety considerations for anyone using cannabis. So, all right, the different methods of consuming cannabis, we went over this in the past too, but, just kind of to give you a breakdown of the main ones, inhalation is the one that people are most familiar with. So that's, John, I'm sorry, I hate to stop the webinar. I keep getting kicked out. Are you hearing me this entire time, or are you missing? Okay, I'm sorry.
We can hear you.
My presenter screen keeps popping back up, so I didn't know if you could hear me.
Yep, you're fine. Keep going.
Okay, so the inhalation. So that's the most common one. Its benefits are it's got a fast onset. It's very controllable. Downsides, lung irritation. If you have any form of lung disease, you don't want to be using this. Chronic obstructive pulmonary disease, avoid inhaled methods. Other people might be able to use it judiciously for the benefit of that fast onset and the easy titration of it. But, you know, it's not my number one recommended method. It's also shorter acting than an ingested method. So an ingested method is an edible. There are a couple of different, you know, products in the market now that are fast acting edibles. So that's something, you know, some of those kick in 15 minutes. Others could take up to an hour. You want to be clear on the product that you purchase. If it's fast acting, you can expect to have, you know, an onset of about 20 minutes for an ingested fast acting edible. For a regular, you know, it can take, you know, for some people, depending on your metabolism, up to 2 hours I've seen. So it's very kind of, you know, hit or miss sometimes with the ingestible things. But the benefits of that is no lung irritation, and it has a longer duration of action. So some edibles can last up to 12 hours of relief, a lot longer than you'll get from inhaled medicine. So it's definitely a good method, and these faster acting beverages or edibles that are on the market now are really good options for people who need pain relief fast but don't want to smoke. Another option for that would be the sublingual method. That's kind of a combined method. It's you take an oil or a concentrated oil, place it under your tongue, hold it from anywhere from 90 seconds to really up to 5 minutes, and get absorption in your mouth, and then you swallow it. So that way you get kind of a combination, a faster onset with the sublingual, as well as an extended duration. So it's also very easy to titrate. Clinicians use it all the time. And so tinctures are always a great option, especially if you're new to cannabis and you want to slowly increase your dose. I really recommend this sublingual administration. A couple other ones though, topicals, if you've got joint pain, muscle pain, you can use that liberally. It's not intoxicating. Lotions, creams. We even have some transdermal products that you can apply that have more penetration, that get more into your systemic circulation. So topicals are effective for a lot of people. Don't sleep on those. And then the last one I've added here is specifically because this is a women's health. It's suppositories. So you can use those vaginally or rectally. You just insert and then lay down, I'd say for about 30 minutes at least, if you can, to prevent leakage. But I've had patients tell me they get an effect in 5 minutes. I'd say usually 15 to 30 minutes. You'll start feeling some pain relief in that area localized. It's great for, endometriosis, painful periods. It's great for, people that have pain during sex. Often get a lot of relief from these suppositories. The rectal has a little bit faster absorption, but you can use it vaginally too. And it's definitely something worth considering, especially if you have a lot of pelvic pain. I don't recommend that to, all patients, but specifically women with endometriosis, PCOS, tend to get a lot of relief from suppositories. So those are basically the methods of consumption we're going to be talking about. And now let's get into some of the specific conditions you can use this for. So number one, cannabis for menstrual support. Cannabis is great at reducing pain and inflammation for menstrual cramps. It can also reduce PMS or PMDD, which is premenstrual dysphoric disorder, which is sort of a more extreme version of PMS. So it's great to help with symptoms like anxiety, depression, mood swings, and irritability. A little bit of cannabis can kind of take the edge off when it comes to those symptoms. It's great for, just relieving muscle tension, migraines if you get those during your cycle. Nausea. A lot of people with severe menstrual cramps do experience nausea, and cannabis can help with the pain with the cramps and the nausea. So dual use, it's great for that. And it's also great to help with sleep, which we, know that if you're in pain, your sleep quality is affected. So it sort of hits all these bases. It's a really nice substance. And, as opposed to taking, I have some patients that I know have such bad menstrual cramps that they take 4 or 5 Advil at a time regularly during their period, day in, day out. And that's not great for you. If you can substitute some of that or all of it with a little cannabis, it's safer and a little bit easier on your system. So again, choosing the right method of consumption is key to getting the best results. And it's best used in conjunction with other things though. So heat, light exercise, healthy diet. One of the best treatments for menstrual cramps is masturbation. Cannabis is great in combination with that. So, think of it as part of the toolbox for menstrual pain. And timing is important. If you tend to have PMS or PMDD, start using your cannabis before your symptoms start. So get ahead of it. Start a week before your period is expected. And, you can kind of cut those symptoms off at the head. I think that, just if you're smart about when you start dosing, you can kind of avoid a lot of the pain early in the cycle. All right, so the next, endometriosis. This is probably the number one issue that personally I see patients for with cannabis. It affects 10% of women worldwide. And the symptoms are severe pain during periods, during sex, or when you're going to the bathroom. So severe acute pain, in addition to just chronic pelvic pain. A lot of these women are in pain all the time. They experience bloating, nausea, fatigue, depression, anxiety, and infertility is one of the, biggest kind of symptoms or signs of endometriosis. It can be hard to get a diagnosis. You often have to be operated on, and they have to actually visualize it. It's hard to see this on scans. And, I've had patients that had over a decade before they could actually get their endometriosis diagnosis. I think we're getting better at this in the medical system, but definitely advocate for yourself. If these symptoms sound like you and you're kind of, not being taken seriously, maybe seek a second opinion, because it's common and it's debilitating and it's progressive. So the other thing that we know about endometriosis is it can be associated with a clinical endocannabinoid deficiency. So as we're talking about this endocannabinoid system and the three parts, which is the cannabinoids or the endocannabinoids we produce, the receptors they act upon, and the enzymes that break that down. So there has been evidence showing that women with endometriosis have lower levels of cannabinoid receptors in their uterine tissue. And they also have, often lower levels of endocannabinoids in their system. And so this impaired function of their endocannabinoid system, or reduced endocannabinoid tone, it's referred to sometimes as, it's associated with increased pain and increased tissue growth, because that's the issue. With endometriosis, there is endometrial tissue that's supposed to be on the inside of the uterus growing outside of there. So some of these women have severe back pain. They can end up getting appendicitis, and it's actually endometrial tissue wrapped around their appendix, causing the appendicitis. So it's an invasive condition. And this endocannabinoid deficiency, it's associated with more advanced disease. So I really like with this a layered treatment. As I was saying before, CBD, think of it as that supplement, that agent that can help improve endocannabinoid tone, increase the number of receptors in the uterine tissue, and increase the amount of endocannabinoids that your body's producing. Now, that's not something that you can just take CBD once and it helps. Think of CBD like a vitamin that you take every single day. That's when you're going to get good results. I see people start, it works in a subtle way, and it takes time for its action to build up and really be seen in the body. Give it 30 to 60 days of regular use. Then you'll know you really gave it a shot with CBD. So, I like to, remind people of that you're not going to maybe notice the full effect right away. You need to give it some time. But that's because it's helping your body do its job better. So over time, you're going to start feeling better. And then THC is wonderful for reducing our perception of pain, relaxing muscles. So that can be really helpful for this. So with these patients, I tend to see a regimen that involves both compounds, daily use of CBD for sure. Some people use THC every day as well, and definitely using THC for breakthrough pain and other symptoms like that. But it can be an incredible treatment. And because we're finding out more of this endocannabinoid deficiency, it's certainly worth a trial. If you have an endometriosis diagnosis, giving a cannabis, a cautious trial is a good idea. In addition to endometriosis, so the next condition I want to talk about is PCOS. Now, PCOS it affects between 5 and 10% of women globally, and it has a different kind of symptomatology. It's characterized by irregular periods, ovarian cysts, infertility is often associated with this as well, and high levels of androgens, so male hormones. They're associated with acne, weight gain, and hair growth on the face, on the chest, sometimes the back. We often also see insulin resistance and obesity in these patients. It's all related, and it's not like you are obese, so you've caused PCOS. The PCOS and the insulin resistance is part of the disease process. The obesity and the insulin resistance, that's part of the PCOS. So getting control of your insulin and your A1C numbers, getting a control of that metabolic syndrome that's part of this is a big part of treating this. But we've also seen this involvement of the endocannabinoid system in PCOS. So we know that anti-inflammatory, mood elevating, and analgesic or pain relieving properties of cannabis can really help manage the symptoms of PCOS. And cannabis use might be associated. There's a lot of research showing that it can help with improvements in insulin sensitivity and glucose metabolism. We need more research on this, but there is research being done. So again, a combination of different cannabinoids could be helpful with this. One, I want to shout out that I think that, they should be doing more research into this is THCV. It's another cannabinoid. It is associated, or it's been found to help with insulin resistance and glucose metabolism. So more research to be done, but if you have PCOS, cannabis might be a good adjunctive treatment for what you have going on as well. Then next is, cannabis for sexual wellness. Now this is, kind of undisputed. Cannabis is helpful. There's a lot of recent studies that have come out on this. So a 2019 systematic review looking at all the existing research up until that point found that cannabis use is associated with increased sexual desire, sexual satisfaction, and frequency of sexual activity. Then in 2020, there was a study that found more frequent cannabis use in women was associated with heightened arousal and stronger orgasms. And then just this year, there was a study that found participants perceived that this was survey for patients. They perceived that their cannabis use increased their sexual function and satisfaction, especially when it came to their level of desire and the intensity of their orgasms. So amazing, right? When using cannabis with a partner, and this is my old, sex educator talk, remember the 3 C's. That is contraception, if you don't want to get pregnant, consent, always, and communication. When you're using a substance like this, you want to be really clear that everybody's aware of what's going on. Everybody wants to be doing what they're doing. So just remember that when using cannabis, contraception, communication, consent. And so there's some really cool products on the market I've seen now, some suppositories. Again, I said that can help with vaginal pain, cannabis-based lubes. And then low dose edibles or those fast acting beverages are good. And I say low dose for this because cannabis can have a biphasic effect on sexual function. Cannabis is always having what's known as a biphasic effect. You'll hear me say this now and in the future. Biphasic effect means that at one dose, you get one effect, and at a different dose, you're getting a different effect. So often that means at a low dose, you're getting one effect, and at a higher dose, you're getting literally the opposite effect. So start 2.5, 5 milligrams of an edible would be a good place for using it for sex. Using too much cannabis is going to impact, your ability. You might end up becoming anxious or even more paranoid at those higher doses. You certainly can have dried vaginal secretions that makes sex hard. please use lube. But just know that the lower doses are usually better. There's a tipping point, and at too much, and it's going to have the opposite effect. You're going to have kind of impaired sexual function, but there is a sweet spot. I read another study showing that using cannabis before sex for women was resulting in twice as likelihood of having an orgasm. So that's a great fact as well. So definitely cannabis can be used for sex, and I mean, even just, it heightens our sensations and it helps us tune into, our bodies and sensitivity. It can also help you connect with a partner in a really nice way. So I encourage it, be judicious, but definitely use cannabis for sex. And my biggest question always, cannabis for menopause. So here's what we know, what menopause is, as women enter their late 30s, 40s, our estrogen levels start to drop. And when they get to a certain point, you stop menstruating, you're in menopause. So there's a lot of changes going on in the body at that time. So menopause is associated with these dropping estrogen levels, but also decreased endocannabinoid levels and decreased receptor expression, which is the number of receptors available for the cannabinoids to work on. So these changes in the endocannabinoid system can be the contributing factors of menopause for things like hot flashes, mood changes, changes in sleep patterns. They are, doing more research on this and seeing, hey, it's not just the estrogen levels, but the endocannabinoid levels, which are tied up, as we talked about, with those estrogen levels. So they may be contributing that. So, 30%, and also 30% of women over 50 have osteoporosis. And we know decreased estrogen is associated with osteoporosis. It's also associated with reduced CB2, which is another one of the cannabinoid receptors. So reduced cannabinoid receptor expression and signaling. So when those receptors aren't functioning as they should, they're supposed to be involved in healthy bone formation. When they're not functioning as they should, they're contributing to osteoporosis. So another issue for menopausal women that cannabis can be supportive. So I really think it can be an effective adjunctive treatment, meaning like a helpful side treatment alongside hormones. A lot of this stuff you're gonna, if you're having these symptoms, don't just try treating it with cannabis. Definitely speak to your gynecologist. Take a look at your hormones. There could be some work you can do with adjusting your hormones that could really improve these symptoms, and then use cannabis for those other breakthrough symptoms. However, if you're someone who can't use hormones, cannabis could be that first line treatment for you for some of these symptoms. So, think about it. And again, when it comes to this too, it's the same theme when it comes to these women's health conditions, using CBD as a supplement and then adding THC as a specific symptom management tool on top of that. So, you might be using CBD to help with that endocannabinoid system and support your endocannabinoid system, but you're also using THC for a little mood elevation or to help you sleep. I have several patients that on a 4-to-1 or a 5-to-1 CBD to THC have done really well reducing their hot flashes. So we need more research, but it's certainly something worth checking out. And, just because it can help with all of these things, potentially helping with hot flashes, mood, and sleep, joint pain, bone health. I mean, I think it's a good substance to think about including into your wellness regimen if you're a menopausal or premenopausal woman like me. So try it. All right. The last thing I wanted to just touch on is autoimmune conditions. And the reason I wanted to add this is because it's women experience these at a way higher rate. I put a quote from Dr. Gabor Mate, who just came out with a book called The Myth of Normal. Highly recommended if you have a chronic illness. It is a fascinating book. But this was a quote from him. He said, women take twice as many antidepressants, get 80% of autoimmune diseases, and they get more chronic illness and more chronic pain than men do. He used a phrase when I saw him speak recently that really stuck with me, and he called women society's shock absorbers. And I don't know, ladies, does this resonate with you as it did with me? And the reason, the role that women, the emotional labor that we provide in this society, the role that we play can actually be possibly impacting our health. When we are self-abnegating or putting ourselves last all the time, we tend to develop illnesses like this, and in menopause as well. You see when the endocannabinoid levels are dropping as well as the estrogen, a lot of women start getting diagnosed with autoimmune conditions, so it's related. So some of the examples of an autoimmune condition: rheumatoid arthritis, lupus, inflammatory bowel disease like Crohn's or also ulcerative colitis, multiple multiple sclerosis. Sorry, you guys, I'm having a tongue twister today. Type 1 diabetes, Sjogren's syndrome. There's over 80 autoimmune conditions. So it basically means when your body is not recognizing its cells as itself and instead is attacking them. And that's what's going on in all of these conditions. So how can cannabis help? In many ways: reducing inflammation, moderating the immune system. THC can actually reduce immune activity. So that can be a bad thing for, say, maybe cancer patients. But for patients with autoimmune conditions whose immune system is hyperactive, that modulation by THC can be really helpful. Autoimmune people, these conditions that I listed off here, it's a real good chunk of the patients I see. Cannabis helps these folks. It helps with alleviating pain and spasticity, helps with improving mood, slowing or halting disease progression for a lot of these. Having a regular cannabis regimen can slow down the progression of some of these diseases, like MS. And it promotes neuroprotection. Another thing that, we found out about cannabis is neuroprotectant. So if you have a disease, neurodegenerative disease, cannabis can be really, really helpful for that. So again, the autoimmune conditions are associated with that endocannabinoid deficiency. So your combination of THC and CBD can be a great way to treat this. And that's kind of where I wanted to end it. I'm sorry I kept interrupting you guys. It's just something with my computer. That's where you can reach me. So that's my contact info. If you have questions, if you need a consult, please reach out to me. Happy to answer any questions, and I'd love to answer some questions now. So, John, what are people asking?
Excellent. Can y'all hear me okay?
Yes.
Excellent. So the first question for today is from, looks like Joaquin, who says, is it safe to use cannabis when pregnant?
That's a good question. And I knew somebody was going to ask that. So right now, if you ask people, they're gonna say no. We need more research on this. There's been some studies that shown use of cannabis, in utero can later create attention issues with babies, could possibly be associated with low birth weight. But again, our studies they're not so clear. Like some of these moms are, they smoke cigarettes. There's questions whether or not smoking cannabis versus just using cannabis in another form makes a difference. We don't actually have the research on this. Now, there's a lot of people who have used, and I'll just shout this one provider out that I know of. She's based out of New York, but her website is the Cannabis Doula. And she's done a lot of educational presentations on this. So I'm not an expert on this. I don't typically work with pregnant women, but like any other medication during pregnancy, it's a risk versus benefits. So, you often see women using this for hyperemesis. They can't stop throwing up the early, beginning stages of their pregnancy, or some people the whole time. The risk is loss of the pregnancy. Sometimes Zofran or other antiemetics don't work, and cannabis does. So in that case, you might analyze that risk versus benefit. But I'd actually love to see the CCC do a presentation on this, and maybe we can invite the Cannabis Doula, because I'd like to talk to her more about this. So as far as using cannabis during pregnancy or breastfeeding, there's right now err on the side of caution maybe. But if you have a condition that needs to be treated, cannabis might be a safer option than some other drug that they would give you. So it's an individual thing, and the jury is still out. We don't know.
Excellent. Another question from Sunania. What's the right amount of grams to start with? And the above question, does a blend of THC and CBD help, or purely CBD?
So it depends on what the symptom you're trying to treat is. It really does. So, like I said, if you saw on that side, CBD is great for inflammatory conditions. CBD is great as that supplement to support, and for something like that, I usually tell people starting with CBD, 20 milligrams isn't a bad place to start for a daily supplement of CBD. If you have a condition that is associated with an endocannabinoid deficiency, I'd go much lower. If you're new with THC, like I said, 2.5 milligrams. That's a nice place to start. You'll often find the edibles in that small dosing. It depends. Some people get relief from just CBD. Others get relief from a combination. And, it depends. Some people get relief with more THC and less CBD. Others, it's the complete opposite. So it's a matter of just slowly trying these things, based on what you need, kind of starting with which cannabinoid you think is going to be more helpful. If you need to sleep, I would say start with a little THC. If you have, arthritis, CBD is a good place to start. So it depends.
Excellent. And Gisela says, so if there's a deficiency in CB1 receptors in the endometriosis, does that mean that using CBD over a period of time increases receptors? Would that be a temporary fix, or would that person now have more receptors even if they stop using? Ooh, interesting.
Okay, so there's a division we don't have data on this. So this would be conjecture based on what I'm saying. And when it comes to endometriosis, because it's this clinical endocannabinoid deficiency, you may have to supplement with that long term, or, but I haven't had a patient totally balance all of their issues just using CBD. It's often a multimodal approach. So if this is an endocannabinoid deficiency, you just got to kind of see. We don't have I don't have a test that I can give you to say, okay, this is actually what you need right now. This amount of CBD, this amount of THC. So the endocannabinoid system is always changing. It's not hey, I can build up my receptors and it's going to stay like that. It responds to that. The system is smart. So the receptors are, expressed more when your body needs more cannabinoids, and when it doesn't, they might go away. So it's not a static system. It's an ever changing. So, you might supplement with some for a while, stop, be okay, and then find later you need more of it. Something's happened. You're out of balance again. But just know that the system is constantly adjusting. It's never exactly the same. And it's always working by taking those three elements of it and playing with the enzymes, the cannabinoids, and the receptors, and changing how much of that is going on at a time in order to balance your body. So does that answer the question? It's not a static thing.
Excellent. And then Tanya would like to know, any concerns of cannabis use with other hot flash treatments and modalities, such as Effexor? Any possible negative drug interactions?
There's definitely can be drug interactions. With Effexor, I have a lot of patients that use both cannabis and Effexor. And, they're doing just fine on that. If you're concerned about potential, if you're on several medications that use the same enzyme system to break down that drug, cannabis, Effexor, if you're on multiple, what you might want to do is I'm not worried about really an interaction, something going wrong, but don't co-administer. Co-administer them a few hours apart, and you're going to have less of that interaction when it comes to competing for enzymes. And we talked about last time, there's plenty of other drugs that can have interactions with both CBD and THC. So if you're on medications, check with your provider. Check with your provider, because it could be specific, and it could definitely depend on the total amount of medications that you're on.
Excellent. Excellent. So we've had a great webinar. If anybody has any more questions, you can reach out to me and at john.s@consumercannabiscouncil.com. And Katie is available at katie@moderncompassionatecare.com or at Cannabis Nurse. And so our next event will be happening on June 8th, the second Thursday of the month, where we will be talking about family therapy and pediatrics in cannabis and the really interesting and innovative advances and research that's being done right now in the space of children and family health. Thank you very much, folks, for coming, and we look forward to seeing you again very soon. Thanks
Happy
again.
Mother's Day, everyone who's
And
celebrating.
happy Mother's Day. Thanks, folks. Have a great rest of the week.